Hello, this is my Module 7 Population Level Health Education Intervention presentation. My name is Noli Raz. This is for Nursing 447, and it is 12/9/2017. For the first slide, I chose Santa Ana, area code 92701. This first slide is an introduction regarding health-related problems and issues for the city. Early on in this class, we were to do a windshield survey, and I chose two cities, Santa Ana and Irvine, which are in the Orange County district. But for this for this project, I chose Santa Ana because Santa Ana is underserved, and the population is bigger, and they have more problems in Santa Ana. The four comorbidities that I wanted to talk about regarding Santa Ana is obesity, hypertension, diabetes, and hyperlipidemia. These four chronic diseases are interrelated because of the fact that obesity can cause hypertension and also diabetes and hyperlipidemia. And then with poor diet causes obesity, so they're very interlinked. One of the major reasons I chose also Santa Ana is that Santa Ana has poor access to healthcare. At least the community of people of Santa Ana have poor access to healthcare, and lack of education in the community. So by us reaching out to the city, we'll at least give them more education about treating these comorbidities. A little bit about the background regarding Santa Ana. As of 2016, the total population based on the census evaluation was a little under 350,000 people, about 334. So was able to look at the population breakdown. It's about 74.9% Hispanic, 45.9% Caucasian or white, and then 11.9% Asian. A couple other facts that while I was researching also is that there's a 25.8% of persons without healthcare insurance that are under the age of 65 years. So that's a pretty significant percentage regarding healthcare coverage. That's 25.8% of people in the city of Santa Ana that do not have health insurance. So we're looking at 25% of 334, which is roughly around close to a little under 100,000 people in Santa Ana do not have health insurance. Another reason why I chose Santa Ana also is that there's 21.2% persons in poverty. The poverty level is pretty high. And then also a real quick fact is the median household income was $54,000 in the year of 2016. So that's very, very low, especially with the high population, and then with with the families having more than 2 to 3 people in one household. So that's pretty low. In regards to the Healthy People 2020 health objectives, I wanted to review some of the diabetes objectives. There's about 7.2 new cases per 1,000 um, population age 18 to 84 years. One of the objectives is to reduce the disease burden of diabetes and improve quality of life for those who have it or are at least at risk. Another health objective is at least to push nutrition and healthy weight status, promote and reduce chronic disease risk through consumption of healthy diets and achievement and maintenance of healthy body weights. So with that, will also help the chronic morbidities like obesity and hypertension and hyperlipidemia, which is kind of, again, umbrellaed in the, if you reduce these chronic, if you reduce this chronic risk by healthy diets and healthy body weights, you will also lower your chances for hypertension and hyperlipidemia. Oh, another thing was also to promote medication compliance. This slide is regarding needs assessments. There were three needs assessments that I used. Obviously, the stakeholders and key stakeholders were interviewed. Also looking on the websites to collect information regarding public health on the Santa Ana Orange County Department of Public Health website, and then also used the United States Census Bureau regarding information and collecting information from regarding Santa Ana and statistics from the Census Bureau website. Okay, so with the theoretical framework and model is the precede and proceed model. So this part of the model consists of a focus assessment that allowed me to collect important epidemiological, behavior, and environmental factors that are affecting the city of Santa Ana. After the assessment, outcomes and goals were stated and measured against factors that could influence the goals at the end. Then to proceed, this is the part of the model that allowed to review and develop education to teach the patients based on goals set in the precede model. After the implementation of the better health choices, review of previous objectives were met and evaluated what can be done differently to improve outcomes related. So in this model, I was actually working with a nurse practitioner at a free clinic in Santa Ana, and we were actually was able to talk to patients regarding their health status and promoting diet and medication compliance. I used a pamphlet and gave out some fruits to promote and hopefully reach out to the community regarding the importance of prevention and medication compliance so that they can lower their blood sugars, blood pressures, and just an importance of just being compliant with the medical treatment. So with that being said, it was difficult because a lot of the patients worked. A lot of the patients did not have insurance and did not have access to medical care. So that's why the free clinics is important. way and access for these patients that don't have medical care access for them to get help. So I found it very rewarding. But again, by using this pre-seed and proceed model, it just kind of organized the way to not only set your goals, but also how to collect the data so you can evaluate it again at the end of the project. So the outcome issues regarding this project, there were some barriers. As I was going through some of the patients I was able to talk to, housing, education, status, and socioeconomic were some barriers. Some of the behaviors is like poor diet, exercise, non-compliance again with medication administrations. Not only because they didn't want to take it, they just didn't. Some of them just didn't have the money to pay for the medication, so that was just difficult. Genetics is always a problem. I mean, patients that have history of diabetes, they're just inherited with the genes and they're just predisposed to these chronic diseases. Again, the barrier was no access to healthcare. These patients do work full time, but they're not offered benefits. So it's just difficult. Again, the median household income is so low that healthcare is unaffordable. Education, one of the things to do is to just, again, is to implement and teach importance of a healthy lifestyle. Reach out and let them know that there are some church and religion support out there in the community at their local churches. There are some outreach programs that are available also, and then also community resources. So we always want to try to, the Orange County Santa Ana website regarding public health has some outreach programs where you can navigate through there so you can get some information. That's always a good place to get access to. So these were just a couple of the barriers and a couple of the education parts that that I wanted to review for this slide. Regarding budgets and logistics, I mean, I did use some colored pamphlets that I just made out, and there was regarding diabetes and diets that were in color, because it's always good to use color. Also, the nurse practitioner told me to get some apples and bananas to to hand out also. And then budgeting time was difficult because I also work full time, so I had to budget the time and allot time for talking to patients and at the clinic. And then collaboration with the outreach free clinic, like I said, with the nurse practitioner and organizing time to reach out to the community also. So that also just took some time. Well, really, the budget's really low, so it wasn't that bad. Now regarding the outcome project evaluation, my goals and objectives for this project was to increase and help the underserved community that suffer from diabetes, hypertension, hyperlipidemia, and obesity regarding healthy lifestyles and diet alternatives regarding nutrition within the community of Santa Ana. So my goals were met. I was able to reach out to a couple families at the free clinic and was able to teach them about some of the diet, good healthy lifestyle changes and diet alternatives. but I did feel that I wasn't able to be successful because of the large population of Santa Ana. I mean, there is a large population of Santa Ana. In regards to the heavy Hispanic culture, um, even though I was able to reach out to them and talk to them, it was just difficult to teach them about. They're receptive of the teaching, but the thing is could they actually follow through? With the cost of groceries, um, they have staple foods that they eat on a daily basis, like tortillas and rice and beans. So um, it would be definitely a change in their diet um, regarding a more healthier lifestyle. So yes, I did feel that I was not successful in that part to reach out to the larger population of Santa Ana. Overall, um, I do have to say the patients were receptive of possible change in their diet to prevent more chronic issues. Many patients were engaged when I was talking to them, talking about their diseases, so that was good. But some of the weaknesses and problems is just a lot that was kind of common that I heard was it's just the lack of time to prepare meals. I mean, these patients again are all working full time, so it is difficult. Again, I brought it up earlier about the cost of food is costly, so like fruits and vegetables and a healthier lifestyle is a little bit more expensive. Again, medication insurance was always an issue. A lot of patients did not have insurance, and a lot of patients could not afford the medication. So that is a definite problem. And then because of work, sometimes there's just no time to see a medical provider. So that definitely is a problem. Santa Ana, again, like I said, is a big population of over a quarter of a million people that live in Santa Ana. Um, and this is just touching the service regard. My project was just touching the service. I'm trying to get help for people of the city of Santa Ana. Um, you know, just to continue, we just need to continue on to help these underserved communities. And this is just, I'm sure, just one city that overall that does need some help and that has high population. So um, these are my references. I want to thank you for your time. This will conclude my project. Thank you.